And we are recording. Okay, so hey everyone, my name is Sonia Gordia. I use she, her, aya pronouns, and I am one of the pre-health advisors here at U of O. And today we're going to do an interview overview. I'll let Amanda introduce herself.
Hi, everyone. I'm Amanda Collin. I'm the other pre-health advisor here at UO. Great to see you all here to talk about interviews.
All right, let me get my cursor going. 1 second here. There we go. All right, so today's agenda, we're going to go over interview logistics. We're going to go over the format and do a deep dive of each of those formats. And then towards the end of the presentation, we'll talk about some tips and some resources for you. All right, so interview logistics. So the interview season for health graduate programs happen between the months of June through March. And of course, that varies depending on the health graduate program that you're applying to. So for example, if you're applying to PA school, the application opens in April. And depending on when you submit that primary application, the earliest you could get an interview would be in June. So if you submitted pretty early, you could get a pretty early interview. In comparison, for MD-DO application, that application opens in May. And so you're going to be working on secondary essays between July and August-ish. And so the earliest we've seen invitations for interviews would be mid to late August. Okay, and that can run through the following year. And so you can see how other health graduate programs might fit within those time ranges. So when you do get invited in for an interview, it's super important that you respond promptly to the invitation. Okay, so the earlier you interview, the earlier you may get accepted into a program. Of course, every program organizes their process different, but many programs is rolling admissions. And so in that case, they'll interview you. And then quickly thereafter, you'll get a notification whether or not you are going to be admitted into that program, waitlisted, or denied, or maybe you're going to be put on hold. Okay. And so the earlier you interview, the earlier you may get accepted. Some programs may not follow that rule. They'll want to interview all of their candidates and make decisions towards the end. Okay. You'll be given options for day and time when invited in for an interview. So you're going to get a notification via your email. Make sure you're checking your spam and your junk mail because you don't want to miss out on an opportunity to get interviewed. Okay. But when you do get that interview, it's usually going to prompt you into some sort of login system. You're going to fill that out and then you're going to schedule your appointment for the interview. Okay, so these can be in-person interviews, they can be remote. I would say for the most part, programs are doing remote interviews, but there are still some programs that are doing in-person. I've seen that for PA and dentistry. And there are a couple programs out there that might do either or. Okay, choose the one that works for you. You know, everybody has their own financial budget. You know, we're all working or going to school. Pick the one that's going to work for you. Okay, choosing one over the other one is not going to negatively impact you. They're going to look at both of those equally. Okay, so once you have scheduled your interview and it's coming up towards the date of your interview, you're going to receive an email notification with general information about the format of the interview. Okay, so some important things to note about that is whether the interview is open file or closed file. They may tell you which one it might be. Okay, so open file means that the person interviewing you has access to your application material, or maybe they have limited access to your application material. Okay, so they might know some general information about who you are, where you went to school, what your passion is for pursuing that field based off of your personal statement. Okay. Closed file interview means that that person who is interviewing you has zero access to other parts of your application. Their job is solely to interview you. Okay. They should also tell you information about the format and the length of the interview. It could be 2 30-minute interviews in a traditional format. It could be one traditional interview for 30 minutes or an hour. Maybe it's MMI, maybe it's a group interview. We'll go over those different formats. They'll also tell you about the structure of that day and other activities that might be going on. So generally speaking, programs do like a program overview where they talk about the curriculum and other aspects of their program. There might be a session with current students where they're talking about their experience in the program, and then there might be a campus tour if it's in person, and sometimes even a virtual one. So why do an interview? So it's an important part of the application process. So most health graduate programs are going to do an interview, but I will say that some don't. I've seen that for athletic training. I've seen it for some veterinary programs and a few others. Okay, so make sure you're checking to their websites to see whether or not they require an interview. But admissions committees want to know more about you. They want to meet you. They've read your application. They've read your personal statement and your activity descriptions. They've looked over your resume. They are really excited to get to know you at a more interpersonal level. Okay. So this is their opportunity to really see who you are and what you're about. It gives them a better idea of who they want to admit into the program, but also know that this is your opportunity to learn more about their program. Okay. It's not them interviewing you, it's you interviewing them as well. Okay, so pay attention when you're in those info sessions where they're going over the program, when there's students talking about their program, because all of that is really great information for you.
All right, so what are programs looking for during an interview? For most of you, you should be pretty familiar with these. These are the core competencies of, I would say, like most of the health professions at this point. Med schools are really the ones that are pushing this kind of competency-based rubric forward, but a lot of other health programs have also adopted the similar idea of like, these are the essential qualities we're looking for in a candidate, right? And you'll see a lot of them are, pretty straightforward. These are the kinds of things that we talked about in your personal statement drafts, right? All about, why you want to pursue this degree or this kind of medicine, right? How have you demonstrated that you have the personal and emotional maturity to do a graduate level program, right? Those kinds of things. So these should feel pretty familiar. All of these qualities are, again, like I said, connected to the core competencies, which we'll see on the next slide here. Right. And so here we've got those core competencies. So like I said, all of these topics are going to be on hand. There are going to be a couple of questions about your academic performance, but you should expect most of these to be about these other competencies, right? Most importantly, and kind of foremost is your patient care skills, right? They're really going to be looking for your kind of philosophy, and how you approach medicine, right? How you approach patient relations. They're going to be looking for evidence that you respect patient autonomy, that you respect cultural differences, all of those kinds of things. There are really no wrong answers here because, again, it's not about sort of reaching a certain standard. It's about displaying that you have this quality in you, right? Okay.
All right, so transitioning to talk about interview formats. So there are potentially 4 different ways that a school can interview you. So one of them is, of course, a traditional interview. And so that's the one-on-one interview, you and someone from the admissions committee. It could be about 15 minutes or up to an hour interview. The other option would be a panel interview. And so that is you plus other committee members. So multiple committee members at one time interviewing you. So that is, again, about 15 minutes to an hour. And there could be just one of those interviews, or maybe they do a couple of them. And that simply gives the committee members an opportunity to see you kind of holistically. Think, for example, like when you are in a lecture hall and you're jotting down notes on one thing that your professor is talking about, you might forget to hear a couple words that they say thereafter as you're taking down notes. And so by being part of a panel interview, that gives the committee members to really get some detailed notes about you as a candidate. Okay. Group interview. So that is you plus other candidates. So you're working alongside the other candidates. You're working together. Okay. The timing on this really ranges on the programs, and there's many different ways they kind of organize a group interview, and we'll talk about that. But in recent years, there's been an uptick on group interviews. It doesn't happen often, but I do want to make sure that y'all have a general idea of what that could look like. And then the multiple mini interview, also known as MMI. And so these are multiple 4 to 10-minute interviews, and they're typically scenario-based questions or ethical-based questions, or sometimes even character development. So those are generally more like traditional type interview questions. So MMI, general structure, so there are multiple mini interviews. So you are presented with a scenario, you respond to that scenario between 4 to 10 minutes. That interview ends, and then you transition into another one, and you might do multiple rounds of that, okay? You do get some time to prepare your response, and every school gets to organize the length of prep time and the length of response time, okay? So it could be that they give you 4 minutes to prepare for your response and then 8 minutes to answer, or it could be 2 minutes to prepare and 4 minutes to respond. It really varies. And in addition to that, it varies as to whether or not you're allowed to take notes or not. Okay, so you got to practice both. Okay, so traditional and panel interviews. So what are they assessing? What kind of questions should you expect here? So in this type of format, they are assessing your passion for the field most importantly. They also want to know you as a person and how you present yourself in terms of your communication and your maturity and your ability to critically think and communicate effectively. So they could be asking questions about, tell me about yourself. That's a pretty standard general question that a school could ask you, or even in an interview. So you got to practice your elevator speech. That's about 90 seconds, no more than 2 minutes of you telling them about yourself. And you can organize it by like personal and educational and professional work experience if you want some sort of structure to it. But the most important part is that you tell a chronological story of your life. Okay, it has to be in a story format. It has to flow. Okay. The other question would be, why do you want to be a blank? Why do you want to be a doctor or a veterinarian or a physical therapist? Okay, you got to be able to cohesively respond to that question. You've been practicing it, you've been writing it in your personal statement in different parts of your application, but now is the time to restate it in a cohesive way that's also going to exert passion and excitement. Okay, because they're going to be assessing you for that. Okay. Why are you interested in attending this program? Do your research. Make sure you are Googling the name of that program and looking up the mission of the program, reading the curriculum, reading who is teaching in that program, seeing like who you find interesting and who you could see yourself being mentored by. What connections do they have to the local community, or what does the local community look like? Okay, all of these things are really great things to look into. Okay, so do your research on the program so you can be prepared for a question like that. What is the biggest problem in blank? They want to know that you have a clear understanding of the field you're applying to. So this is your chance to highlight your experiences within that field. Okay. And what questions do you have for us? Don't let this trick you, okay? You want to make sure that you have questions that you can ask them, okay? And you want to make sure that it's going to be a quality question. And so a quality question is one where you're disclosing information about yourself and then asking the question. So here's an example. I am interested in working with OHP patients as a dentist, and I find this area of dentistry important in order to work with underrepresented populations. I'm curious what opportunities are available at your institution to engage with this population. Okay. Or maybe you're really big about mentorship and community. You can ask a question saying something like, I find myself thriving in spaces where there's a lot of collaboration and teamwork. It's something that I've done throughout my undergrad in X, Y, and Z courses. Can you tell me more about what collaboration and teamwork looks like at this institution? Okay, so general format, disclose information, ask the question.
Yeah, so doing your research and thinking about again why this program is already a great start to preparation, right? But how do you actually prepare physically for the interview is also a big deal because you do want to actually practice. However, you don't want to sound super scripted and robotic, right? So for traditional interviews, you do want to definitely think through all of the possible questions that you could get asked and think about, certain stories that would like go alongside with it. So for example, you do want to think of examples for situation where you had to resolve a problem, where you made a major clinical mistake, where you failed in some way, right? You want to think about examples of working in a team. What was successful about it? What was not successful about it? Because also remember that your ability to recognize where you went wrong and how you're going to fix that in the future is a great sign of not only your maturity, but of your preparedness, right? This is a field where things are changing all the time. You're going to be receiving training for the rest of your lives, basically, right? You're always going to have to learn something new. So you do want to demonstrate that you have that ability to adapt and to change, right? And that you're self-reflexive, that you're always constantly thinking about how you can be a better whatever medical profession you're pursuing, right? So for traditional interviews, there are a couple of questions that you definitely need to practice out loud, like actually practice saying it. Maybe it's to an actual person, maybe it's to one of us, maybe it's to the mirror, maybe you're recording yourself, right? But you do need to physically say it out loud. So many students think that they can just do it in their heads. No, you need to get the words out of your mouth actually. So practice summarizing your why, right? Why this profession? Why this field? Why do this at all, right? And then again, as Sonia said, practice your other elevator pitch, practice describing yourself, right? In a very concise way. Sonia's also talked about storytelling, right? So yes, key here, remember that you need a beginning, a middle, and an end, right? How did the situation start? What was the circumstances of this example? What about this example is important? Why is that example important? How is it going to show that you're a good PA or how does it answer the question, right? So always make sure that you're moving through your questions in that kind of manner. So tools for you to practice. So number one, you can definitely schedule mock interviews with us. You have access to hour-long appointments for mock interviews with either me or Sonia. There are also career center tools through their website. So for example, there's this big interview tool that you can use. This is a great time for AI. Like this is where it makes the most sense because you can feed an AI bot a ton of these like sample questions that you get off the internet and you can practice with this AI bot. They can, generate new questions because another essential skill that you'll be focusing on is how to deal with a question that you haven't prepared for, right? What to do when they do throw you that curveball. How do you organize yourself? How do you answer it, right? Um, okay. Um, oh yeah. So also remember that there are certain strategies to do if you need some time to think, right? Number one thing you don't want is to just sit there in silence, right? So there are a couple of ways to do this. As Sonia already said, like repeat the question, right? That buys you some time. You can also ask for clarification, right? Saying, I'm not quite sure what you mean by this word. Could you explain it a little bit more, right? They'll take the time to explain it. That gives you a little bit more thinking time. Um, take a sip of water, right? You can also just say, give me a second to think about it, but then just make sure that you're not taking too long, right? So again, it's mostly about making sure that they know that they're not wasting their time, right? That you are actively coming up with a question and also that you don't take too long to answer because of course, in medicine, if you take too long to answer or to make a decision, that could be the wrong move, right? So we want to be prepared for the unexpected as well.
Right, and here are some more sample questions. So for this slide, I think the key thing that I want you to think about is how are these questions tied to competencies or skills? Because that can be helpful in thinking about like what is the root of the question and how can I identify an example that's going to give them what they're looking for, okay? Because you want to be able to pull examples out of your back pocket for every question that you're being asked, so much that you're so prepared that you know like the different examples in your life that you can use, right? So for this question, can you tell me about a time when a lack of teamwork hindered a project? How did you address the situation? So what are they asking in this question? Well, they're asking about your teamwork skills, but they're also asking about your ability to problem solve. Okay, so they want you to elaborate on that a little bit more. Can you give me an example of how you approach inclusion? Here's a diversity, equity, inclusion question, okay? Be prepared for those because you're gonna be asked those questions, and there are many different questions that you can find online that is a variation of this. Okay. How do you maintain balance in your work, class, and personal life? That one tends to shock people. Why would you want to know what I do outside of a clinical setting? Well, they want to know you as a person, okay? They want to make sure that that they want to make sure that you know how to take care of yourself, that you know how to deal with high stress situations. Because when you're in health graduate school, you're going to be pushed to the limit and beyond. Okay. It's going to be a hard time. So you want to make sure that you have the fundamental skills to be able to manage those hard times. Okay. Tell me about a time you experienced change in your life. How did you handle it? They're testing your adaptability skills. Okay. So these are all really, this is like a really like general way for you to think about questions. Like what is the root of the question? What is an example that I could pull out of my back pocket to answer that question? Okay. And of course, that last question, how do you handle a peer in medical school cheating on a test? They're testing your integrity. Okay. Okay, so group interview. So again, as I mentioned before, this is not a common thing, but I have seen schools starting to utilize group interviews a little bit more. So very rare, but it is coming up. Okay. So they are, the format really varies. The length of the group interview really varies. The most important thing to know is that there's many different formats that a group interview will be structured by. So there'll be a general interview question. It could be structured that way. They could be doing some case studies, some practical tasks or role-playing exercises, or even a group presentation. I would say out of all of those, the most common ones are going to be the practical tasks or the role-playing exercises, and maybe some case studies in there. Okay. But for these, there's honestly not a lot of prep that you can do. You really got to roll with it. Okay. And be prepared. You know, what they're really doing is testing how you work in a group setting and how you interact with other people. Okay. So here's an example of a practical task. So here, sit back to back with a partner, another candidate, and instruct your partner to build a Lego structure identical to the one in front of you. So admissions committee members will be observing you and your partner. So for this example, what they're really asking, what they're trying to observe in you is your ability to communicate effectively. Okay. Maybe they're testing your creativity skills. Okay. Maybe they're testing your problem solving skills. Okay. So you can find that group interviews will not be a common thing, but if it comes up, here's some general information about it.
Okay, so multiple mini interview is another very popular style of interview. Again, it is like most prevalent in med schools, but more and more health professions are adopting at least this style of question, if not the actual interview format. So the MMI interview is, it can occur in a bunch of different ways, right? So number one, it could be either an online or in-person interview with one other person. It's just the style of questions that they're asking and the kind of answers you provide are very different. It could be something where you go in person and it's you're moving room to room, right? So room one is for question one. Once you're done with that, you go into room two and you do a different question. It could be a huge group setting where you're going through a bunch of stations in one room. So you can go to table 1 and they'll ask you a question. Once you're finished with that response, they tell you, okay, go over to station 2, and you kind of make your way, throughout the room. Some of these could be recorded, right? So they could say, you have 2 minutes to review this video that asks you the question, and then you have 8 minutes to film a response, right? Or your response must be no longer than 8 minutes as a recording, right? So that's also a possibility. So really what MMI refers to is the kind of style of question and the style of answer. So where traditional interviews are really sort of focused on getting to know you, MMI interviews kind of incorporate more of that situational and scenario-based questions. So it is more about, not just getting to know you as a person, but also thinking about getting to know your thought process, your leadership kind of levels of comfort, right? Are you more of a follower? Are you a leader, right? Those kinds of things. How do you react with uncomfortable or unfamiliar situations, right? So for a lot of these kinds of questions, what they're really looking for is evidence of the way you think and of the way that you make decisions, right? So what are the details in these scenarios that is leading you to either say, okay, I need to get more information, or what information are you receiving that says like, okay, this is why I would take this action or come up with this solution, right? So for the types of questions that you're about to see, you're going to see a lot of ethical scenarios, right? So just like the question that we just talked about, one of your colleagues is cheating, what do you do, right? They're going to be situational based scenarios, right? So thinking about, all right, we've got some sample questions on this next slide here, right? So thinking about this, first one, which is kind of both ethical and a scenario question, right? Which says like, okay, you're in this situation. How do you deal with it, right? It could be one that's kind of personal like this, where you're dealing with somebody that you go to school with or you work with. It could be in regards to a patient. So a lot of times they'll ask questions about like, you have a minor age patient, they're going through this, you suspect child abuse, what do you do, right? And so in those cases, again, they're testing whether or not you know what kind of questions to ask, right? Whether they're questions you're asking the patient or whether they're questions you're asking your hospital, right? You might say something like, well, I'm going to need to know the laws around being a mandated reporter or something like that. You don't have to actually know the ins and outs of the actual law or the actual like hospital policy, but you should acknowledge that there is some role that like laws and policies are playing in how you approach a patient, right? They're testing for your communication skills. You're talking to a minor child. How do you adjust the way that you talk to them, the way that you ask questions, right, in order to gain their trust and to develop this bigger picture of their health, right? Those kinds of things. You're also going to get certain questions on uh, character development as well, right? You might also get some questions where they ask you to kind of role play or to act in a scenario, right? Again, it could be any of these ethical or situation based questions, but they'll say like, pretend I'm the patient, or, you know, Charles over here is going to be the patient. Ask him the questions that you would ask if you were in this kind of situation, right? So there might be a little bit of that going on. And again, no right or wrong answer unless your answer is abandon the patient. That's the wrong answer in every single case. But other than that, really nothing wrong that you could say here, right? As long as you're acknowledging the patient's right to care, the patient's right to refuse care, right? The patient's individualness as a person, you're more than likely going to be fine, right? Again, they're trying to test you on, do you know what kinds of questions to ask? Do you know who, who to talk to? Do you know how to take that information and then make a decision?
So how do you respond to MMI type questions? So here's a general format that you can use to summarize your response. So first and foremost, summarize the situation, okay? There is time that you need to fill in an MMI response. It could be 4 minutes, it could be 2 minutes, it could be 8 minutes. Okay, it really varies program to program. So you need to have like a general structure of how you're going to respond to these kinds of questions. So step one, summarize the situation. It could be as simple as, in this scenario, I am, and then repeat the scenario. Okay. After you've done that, that's already filling like 30 seconds to 45 seconds. So after you've done that, you can name the key issues. There can be more than one issue in the prompt. So be sure you discuss all of them if you have a lot of time. If it's only like a 2-minute response, then identify the most key issue that you want to really hone in on. Okay. Then you want to gather more information. So some prompts are vague for a reason. They do that on purpose, okay? So you want to gather more information in a role-playing scenario. And if it's not a role-playing scenario, you can describe all of the different possibilities. If I am gathering information, I learn ... then I would do this ... But if I end up learning this, then I would do this ... right? Okay, and then you're going to firmly pick your course of action. State your position. There is no right or wrong answer. So remember, MMI is assessing for all of these different skills and competencies. Okay, so make sure your course of action is sustainable. How can you prevent the situation from happening again? What resources can you use? New policies to consider. Is there an example you can pull from personal life to help reinforce your answer? So all of those things are really great things to consider. Okay, so we've talked about traditional, panel, group, and MMI, but I'm sure some of you have heard about these other situational judgment tests. What are they? They're standardized exams, but they're not. They're like an interview. Let's talk about it. Okay. So the two that have been coming up are the preview and the Casper test. So preview, that's specifically for medical school applicants. So MDDO only, mostly MD. Okay. So preview is managed by the AAMC. It is 30 scenarios with 186 questions. So it's about 90 to 100 minutes to complete it, and it's $100 to take the exam, or it's free if you're part of the fee assistance program. Okay, so here is an example of a preview question. So they are closed-ended questions. So you're prompted with a scenario, and then you get to rate the effectiveness of each one of these responses. So you rate it by very ineffective up to very effective, and then you get scored of that. Okay. Now the Casper exam is going to be very similar to that. The only difference is that it is open-ended questions. Okay, so you're given 15 scenarios, 9 types, 6 video responses. And each scenario has 3 follow-up questions. So 5 minutes for all 3 questions. Okay, so again, open-ended questions. It's very much like an interview. So here's an example of that. So you are a member of a study group. You observe members having a heated conversation. Mike and John are confronting Sarah. Sarah gets upset. Sarah decides that she is going to leave because she doesn't want to deal with the negativity. Okay, and over here to the left are 3 different questions that you're going to be running throughout those 5 minutes of responding to this. And you're doing this either typed or you're verbally responding to this scenario. Okay, so contrary to what the internet says, you do want to prep to this. For whatever reason, the internet says you don't have to prepare for the Casper, that you should just go with it because it's very like innate responses. But like any other interview, you're going to prepare for an interview, so you're going to prepare for the Casper. And same with preview. It's a standardized exam, so you want to prepare for that too. Okay, so we have some resources on the Community Canvas site. It is standardized exam prep resources. You're welcome to download that. It has information about preview and Casper. There's a really great podcast about preview and how schools are utilizing those scores. That's another thing I wanted to mention. So in terms of how schools are utilizing these scores, okay, super important that you complete these exams kind of early on in the application cycle. I would say somewhere between April to July is a good time. Okay. I would say that's for preview specifically. Some medical schools might be using that as like a preliminary interview. Okay, so they'll use that to determine whether or not they're going to invite you in for an interview. And other schools are going to use this to determine whether or not they're going to invite you in for admissions. Okay, so they're going to use it more so on the back end once you've been interviewed and they're evaluating all of the different pieces of who you are. Okay, and so that's true for both Preview and Casper. Okay. All right, and then there's these other two, it's Duet and Snapshot. I'm not going to talk too much about these because they're super rare, but Duet and Snapshot, they're also part of the Altea Suite group, and Altea Suite is the company that manages Casper exam, okay? So you won't need to do this unless you get prompted by a school to complete it, okay? And usually the school pays for the exam, or they'll give you instructions on how to pay for it, and it's usually not a large cost. Okay. So the snapshot, this is typically a pre-interview. It's usually about 6 minutes long. There's no set in stone questions, as every program gets to control what questions they would like to ask a candidate, which means you have to prepare for it as if it was preparing for an interview. But it's usually simple questions like, tell me about yourself, or why are you interested in our program? So again, it's a pre-interview. So they're going to use this to determine whether or not to invite you in for an interview. And then Duet, so this is assessing your fit for the program. Not really a way to prepare for this either. I would say the best way to prepare though would be to do research on the program. Make sure you understand their mission and their vision. Make sure you understand the curriculum and what makes them unique. Okay, so be honest throughout the interviews, but also I would say yeah, do your research and make sure that you are feeling prepared for these interviews. Okay, Kira Talent Interview. So this is a platform that some schools are going to use to facilitate their interviews. So this goes more so for the online interviews. So if you ever hear Kira Talent, here is some general information about it. So this is an online remote interview platform that some health graduate programs are using to facilitate the interview. So they organize it by either a live format or a pre-recorded format. So the live format could either be a traditional panel or sometimes even MMI. And then the pre-recorded one, that could also be traditional panel or MMI. Okay, so there are video and text-based responses depending on how they want to organize the interview format. Okay, so for the pre-recorded formats, so the length and the number of questions that you get asked varies school to school. In addition, the number of video versus text-based questions also varies school to school. So similarly, the prep time that you have per question and the response time, that is controlled by the school. Okay, so with that being said, please be sure that you're following the instructions that the school is giving you. And if there is vagueness or you're confused about something, contact the school directly. There's nothing wrong with that. It's better to ask them before the interview than be stuck during the interview, okay? The most important part is that you're able to follow instructions, okay? So it's better to ask beforehand.
Okay, so what do you do before the interview? As we said, do your research, right? Make sure you know why you want to go to this program. What kind of opportunities do they have? What kind of clubs do they have? What kind of things do you want to do there? Why is it a good fit, right? Also, reread your application material, right? You don't want to have a ton of overlap, right? You don't want to just be repeating stuff that we've already brought up. That being said, this could be the opportunity to expand upon stuff that you didn't get to talk about in your application or give additional context. So what I would say is the kind of most defining thing to think about whether or not to repeat a story is what new aspect are you bringing to this story now that you're talking about it in the interview, right? If you're pretty much just going over the same kind of stuff that you said in your paper application, don't repeat it, right? Especially if it's an open file, they will know your application, right? So think about, like I said, a couple of different examples, right? Ones that can be kind of adapted for any of these questions. So take a look at some of those sample interview questions and think about, mapping out a story to, okay, this is a great story for these kinds of questions. This is a great story for this kind of question. If I get asked about patient care, I'm going to talk about this patient, that patient, why, right? What do they show about the kind of quality I was able to care or to give? What do they show about what I learned from that experience, right? Read the news and be aware of what's going on in your field, right? This is part of being committed to the field. You should know what are the parts that are not so good that people are debating about and talking about, right? So for example, for PAs, you might want to do some research on why there aren't PA programs in every single state, right? What are the states that don't recognize PAs and why not, right? You might want to think about questions about the role of the PA and maybe what they can and can't do. What are the ways that the field is looking to expand those roles, things like that, right? It could be current articles about the kind of healthcare that we're giving, right? Should we be advocating to use AI for diagnosis or whatever, right? Some of those kind of larger scale questions could also be fair game here. Develop a list of questions for the program, for the faculty members, for the current students, right? There could be opportunities to talk to them. And in order to get to know a program's mission statement, and kind of the overall vibe and the culture of the program, I highly suggest that you look to see if there are any prospective student info sessions coming up in the next couple of months, right? They sometimes track your attendance, so that can also indicate that you're interested in a program because you're like literally and physically showing that interest by attending their events. Number two, like I said, it's a really good way to get more information on that vibe and that culture of that place, right? Maybe you go to an info session and the way they describe how they go about patient care is not your vibe. That's totally fine. Better to know now than to know later, right? And be super unhappy in that program. So when you're thinking about the questions for the program, for the committee members, or for students, right? Think about those kinds of things, right? What are your goals as a healthcare provider? Ask if how that program is going to help you meet those goals, right? What kind of support do they have for you? And this is key here. So, don't ask them like, how are you going to make this happen for me? But ask them about what support is available to you, because then you look like you're taking the initiative, right? And like seeking out those resources even before you've entered the school, right? Take note of what kind of dress code that they might have, right? They might say specifically, wear something business casual, right? Or business, right? They might not say anything. In which case, again, go with business casual, right? I would say that's kind of like the most casual you can get. So for guys, think, tie but no jacket or jacket but no tie, right? You don't, want to be like so overdressed and feeling like super overstuffed and too formal, but you want to look professional. You want to look cleaned and put together, right? So put on all of the clothes, right? Even if it's virtual, put on the pants, right? Test the outfit out, make sure you're not uncomfortable. Because again, it's all of these like little details that really get you riled up during the actual interview, make you lose your composure. I don't know how many interviews I've been to where I've realized I'm wearing something too hot. And then I'm like sweating like crazy. And then I can't focus on the interview because all I'm thinking about is how they're looking at me and seeing all the sweat roll down your face, right? All of that kind of stuff. Put that out of your mind by testing out your outfit, testing your internet connection, testing your AC, right? Making sure you're comfortable. You want to set yourself up for success here, right? And again, schedule mock interviews. You can mock interview with us. You can mock interview with the Career Center. You can mock interview with your family and friends, right? Mostly the goal is to make sure that you're not rambling enough so that you're boring people and losing them. And that you can, again, react to unexpected questions without totally losing it, right? Those are probably the two most important aspects. And again, you can practice that with literally anybody. But remember that you have access to some pretty great interviewers here at UO between us and the Career Center. Okay. So what to do on the day of the interview, right? When you're scheduling your interview, keep in mind how much practice you're going to need. So I would say for traditional interview, you can schedule that anywhere from a week to 2 weeks out because you won't, I don't think it's productive to practice more than kind of 2 mock interviews for traditional style because after that you tend to get kind of scripted, right? So you still want to be a little bit flexible, but you do want to plan for time to practice for the MMI interview, right? Because again, that's a very different style of interview. So when you're scheduling your interview, don't schedule it too soon to where you can't do any practice with us, right? So plan ahead, think about that, kind of deadline, think about how much time you need to kind of prep and get yourself ready for the interview. Then on the day of the interview, think about whether or not you need a warm up, right? For some people, I'm one of these people, like I actually need to talk to a stranger to get myself into that kind of mode where I am able to like function around other people, right? So on the day of an interview, I might go and like get a coffee and just like make small talk with the barista, right? It's low stakes, but it kind of gets you into that like customer service brain, right? To help you kind of settle into your role as being the interviewee, right? Some people really need peace and quiet before the interview to get themselves together. Great. Do a meditation, right? Plan it so that there's nothing going on. Your morning isn't too busy before the interview or whatever, right? Make sure that you are conducting your interviews in a controlled room, right? Nobody's going to be popping in on you. It's got lighting that doesn't make you look like you're the crypt keeper, right? Those things are not make or break, but they can be incredibly distracting, right? So you just want to make sure that they can see you clearly, that they can hear you clearly, right? Again, wear a professional outfit, full outfit, pants too, right? Have water, snack, notebook, and a pen nearby. I would not advise eating during the interview, but like if you feel like your blood sugar is about to drop, maybe put in like a hard candy or something, right, to help get yourself back into that energized state. But definitely have water. If you're doing in-person interviews, they should provide water for you. You can always ask. If you're doing two back-to-back 30-minute interviews, your mouth is going to get dry. Drink some water. And again, a really good way to stall, right? If you need a little bit of time to think, take a sip of water, right? Notes are going to be, maybe they're allowed, maybe they're not. But if you are doing it online, you do want to take your notes kind of off camera, right? Don't, be standing there with your head down, right? You want to be kind of writing and nodding while you're looking at the camera, right? But you do want to make sure that you jot down all those important details, right? And then during any orientation sessions that you might have, or you might be invited to go to like a mixer or something with current students and faculty members, right? Take notes on the program, ask your questions, right? Take note of your responses. Take note of any faculty members that you spend a long time talking to, because it can be worth it to send them an email afterwards to kind of express, your interest and your gratitude, right? And this is also a great time to think about any other questions that you might have to ask during the interview itself, right? So if you learn a lot of great information during that orientation or during that mixer session, that's great. But maybe you have a couple of new questions now. Great. Remember those, because again, they're really good ones to ask when they ask you if you have questions for them. Because again, remember that those questions for them are also signaling your interest, right? Your passion about getting in. It's about both parties making sure that it's the right fit, right? I know y'all are thirsty to get in wherever you can, but please recognize that there are some programs that are not going to set you up for success. Maybe that's just not the way that you learn. You don't want to put yourself into that position, right? You want to go to a place where you can thrive. So make sure that you're making sure it's that kind of a place.
Can I add something?
Yeah.
Another thing to keep in mind is where you have your camera located, because I know some folks use a webcam. So make sure the webcam is sitting right in front of you so that you are making eye contact with them. And that is so important with the virtual interview, because you don't want them to question whether or not you're cheating. Okay. You don't want them to question whether or not there's someone in the background with some flashcards telling you exactly what to say. Okay, so make sure the webcam is in front of you. And with that being said, when you're practicing your interview questions, you could record yourself on Zoom so you can keep an eye as to what your body language looks like when you're doing a virtual interview, and make sure that that looks appropriate, because they're going to be paying close attention to that. And they know the difference between like looking away to think versus looking away to read something. Okay, so just know that.
Yeah, also, practice like engaged listening on that note, right? So, when they're asking the question, if you're taking notes, that's great, but make sure you like make eye contact and nod a couple of times. And that again, you're not just, kind of head down taking notes because that's not a good look either. Okay, so what to do after the interview, right? So number one, thank you emails, right? Send a thank you to the coordinator or to any of the people that you interviewed with if you have their contact information. But some programs might say specifically that they don't want thank you emails, right? So again, make sure to kind of read through the interview instructions very carefully so that you know exactly what again, they're testing to see if you follow directions, right? If they say don't send a thank you email and you send one, no matter how nice it is, they're going to be like, oh, couldn't follow directions, couldn't read properly, right? They might ask you to send a letter of intent, especially if you're waitlisted. And this is basically a letter that kind of tells them how high of a priority they are for you, right? So basically, how bad do you want to go there, right? Why you want to go there, and any kind of other additional information that makes it clear, right? That like if you were to get off the wait list, you would very much say yes, right? Because they don't want to waste their time if your top program is actually somewhere else and you're still waiting to hear back from them, right? They don't want to waste their time by waiting on your answer when it's going to clearly be a no. So some programs might ask you to send a letter of intent. Get in touch with us to talk about writing it, right? Um, update your letters, right? If you have letters of rec that are coming in, right? If you've got, I don't know, grades that just got changed or whatever, right? Make sure that you're taking the time to do any of those academic updates as you need to do them, right? And then, of course, wait and continue to plan. So this is a good point to remind everybody that you might not make it on the first round. That's incredibly normal, and it doesn't always have to do with how good you are in terms of your like readiness, right? Like sometimes it's literally a numbers game and you just miss the last spot because all of these programs do have a limited number of seats. Maybe you were literally a day too late returning your secondary or something like that, right? Sometimes these things are really out of your control. So I always tell everybody to plan for at least 2 cycles of application. So think about what you're going to do if you do need to reapply, right? How is this year going to be different? What do you think you can improve about your application? From your interview, what do you think was kind of the vibe, right? Did they kind of give a sense that they thought maybe your patient care wasn't, strong enough or something like that, right? And you can also, and I would say arguably most importantly, contact the schools to see why you got rejected if you do get rejected. Okay. This is key. Number one, it gives you a great plan for the next year. You know exactly what to do, right? Two, again, shows your interest and your commitment. You're interested enough to know what you did wrong and you're committed enough to take the next year to fix it and then reapply. Schools like that, right? They want to see that dedication. So after your interview, again, think about your future. What are you going to do if you don't get in anywhere? Right? Maybe start interviewing for regular jobs just in case, right? It's easier to leave that, right? And be like, oh, surprise, I got into a medical program, right? That's, nobody's going to be too upset about that. So don't, think about doing nothing. How are you going to move forward? How are you going to stay active? How are you going to make some money, right? Because that's important too. Um, okay. So yeah, final tips. Don't say what you think that they want to hear. Again, at this point, if we've been working with you on your personal statement, I don't think that this is a problem because again, we really emphasize that you have individual thoughts, desires, opinions that are driving your passion for this career, and they are totally valid, and you should say them and say them loudly, right? So follow your gut. Again, talk about the way that your experiences have contributed to your philosophical approach, right? How do your experiences, how does your life, how does your, how do your academics, how do all of those things kind of contribute to the way that you're coming to this field, that you're coming into patient care, the way that you're going to be with your patients? and what you want to change about your field in the future, right? Because of course, there are still problems in healthcare, right? There are still problems we need to fix. It's okay to say that there are problems, but it's not okay to criticize without offering a solution, right? So if you are talking about a particular area of healthcare that you think needs fixing and you're passionate about it, that's great, but make sure that you're telling them, this is how I'm going to do it, right? I'm committed to this plan. I'm dedicated. I'm going to do this cause, right? You know, you have great reasons for wanting to be in healthcare. Talk about all of those things. Be more specific than I just want to help people, right? As you know, we've always been pushing you to say more about that, right? So same thing here in the interview. All right, so resources. Of course, you have us, right? We have interview prep appointments, 1 hour long. You also can get interviewing help with the Career Center. So you can use it through the Big Interview online kind of, so, like a kind of AI-based system. Or you can actually personally meet with a career coach, right? Ryan Gray, he's got a great book on personal statements. He's got a great book on interviews, right? There are lots of stuff online that you can Google. Reddit, right, is a great place to also look for stuff from people who have gone to that program, right? So make sure you're thinking about these kinds of alternative sources of information. Take it all with a grain of salt, right? It's not always going to be 100% true, and it may have changed in the years since, that Redditor has been online or whatever. But again, those are really good resources for kind of that more personal aspects of the program, right? Checking the vibe, checking the culture, right? Reddit can be in the internet in general. TikTok, all of those sources can be really great for that kind of stuff, right? So make sure that you're looking there as well. All right, so if you've got any questions, again, feel free to reach out. We've got the appointments, we've got the availability now. We've got the email, right? So multiple ways for you to reach out. Over the summer, we are, onboarding new students, but we are still prioritizing our current applicants in terms of appointments. So there are, we have blocked off time where it's just application people, right? If you can't find an appointment with us that works, again, email either us individually or the pre-health email, and we'll work with you to figure out a time where we can all.
Great, and thank you for listening.
Thank you very much.